I have been reminded of the fact that I'm a farmer.
Minti Bibiasio, Aden Ghana Registered Nurses and Midwives Association, Omu General Secretary, Dr. Tim Crane, Ayenye Biano, Okuta PhD, was supplement ni gumbe mu anasade because Sanya wa attack health minister, Honorable Kobna Minta Akandono. But health minister ono so fire back. Yabeko ansem mu into details. Masrawa, sa we be share video we na obetrewa dwen amam your comment section ho. One subscribe here, kindly subscribe to Trends GH on YouTube, Facebook, and TikTok. Bibia Air Trends GH. So Ebano Raf air activists. NAFI Rich Hospital, Ebusuya nurse near Eko so over the weekend year. So Health Minister Honorable Kobna Minta Akando Okopemo Rich Hospital. Okoshe near Eko so Hopote. So after Health Minister ne visit Rich Hospital no Health Minister Honorable Kobna Minta Akando no de ochim say public no omonka omakuma ento omuyim saso ena nurses a omo Rich Hospital no omonka omakuma ento omuyim na omati committee kwa na omo behwe ne a esi hopote ne de omo die atoye sane ebe ya police force so ebe ya omo adwuma adenti ena patient no kopie mo Rich Hospital ho no delay na de ekọ so ewo ho omo no na yade a committee na wate no ebehwe that ensensem ni nyina. So Health Minister Honorable Kobna Minta Akando na no si yepe ena ka bi ebesi nanim no de activist Raf one nurse ensensam no osi free ka no mu a otene ne nsa osan so hage Honorable Kobna Minta Akando. So that particular video no ene ensam a Health Minister Ebusuya odi tu dwa no eno na Ghana Registered Nurses and Midwives Association omu General Secretary Sanya Wegwalai wa attack Health Minister Honorable Kobna Minta Akando no Ebusuya we so use no.
Subsequent interviews, Minister Kase were putting a committee together to investigate in Samoa a course. Adiabako striking me in this statement and they said, Ministry said they want to investigate the circumstances that led to the reported delay in care. Like I said, most members in our hospital may have contributed to the course.
Here me tiny second point. Minister no who said there are systems over there. If he doesn't understand, he should get somebody to educate him. Anything make a choice say triage system so they yes Obi don't buy out me can't buy into the shame.
Yeah, Doc, I get you, but I think because
triage Nia who say oyare no immediate care and I say delayed care as compared to others. If you show no immediate care, they will attend to you immediately. So by time actually others and they will neglect you. They will give you first aid or whatever, but they will attend to other people who need more a year. It doesn't mean that they are delaying whatever. So that statement doesn't make sense to me at all. It doesn't make sense. Whoever wrote that statement doesn't even understand the hospital system. What kind of life is that? What is even more annoying is what the minister did. His statements run contrary to his posture. Look at the pictures on social media. He affectionately embraced the rap guy, somebody who has been fingered as the perpetrator of that heinous crime. You embraced him, and then the guy whispered into his ears, and he was smiling. Whether it was setting or whatever, how did the guy go to know that the minister had come there? I'll rush about her immediately.
Yeah, Doc, I get your point, but I just wanted to draw your attention, sir. In all of this, it is the Minister of Health we are talking about. Some of the statements might sound a bit too harsh. As far as Oyo sector minister, you should be minded by that.
I agree with you, Obi, but you see, Papa no also go mother for. How can you treat places like this? It's a case of disrespect. You go and embrace the very guy, and look, initially, he was being defended. So, management. It's not true. Look, respect is.
Very well.
Is it seconds?
Very well, Doc.
But and some go yen na Ghana fu obi fe Burkina Faso di ba Ghana ate o so wa ba abare nyina bia obi antu na emrentu asem bia che obi a o ma wem
what ya obi crash na say Doc wonim health minister na won ne kasa no but papa no say ne kasa no I say or Gemini voice oh hey we dey ya person health minister honorable Kobena Minta Akando onjine nanim one on one nanka why show betu blue because hey doctor eno na honorable Kobena Minta Akando ebusan wire press conference eno dey eba no health ministry wona enema bi omudi egu akwan mu ode to Ghana fu anim eho eno o kirem say waten sama ekoso eba no ni engagement with air RAF activists any afisu nia ekoso Rich Hospital na wate nia Ghana Registered Nurses and Midwives Association omu General Secretary air Dr. Tankwan ode abetudwa supplement ni gumbi na ono health minister ono so response way na ode man the critics any ni true air Ghana Registered Nurses and Midwives Association omu General Secretary yentie no.
Ladies and gentlemen, at this point, let me use this opportunity to state the chronological event that happened after the incident that occurred at Ridge Hospital. On Monday morning, I sent a delegation to Ridge Hospital to ascertain the situation. When the delegation came up, upon debriefing, I realized that I had to follow up. And ladies and gentlemen, let me state this, that I have the health workers of this country at heart. And so any attempt by any individual or any group of people to try to incite the health professionals against government, pretending he cares more than us, is unfortunate. And we must stop that. It's an avoidable tension we must avoid. It doesn't help the sector. If indeed you are a practicing health professional in the sector, it doesn't help the sector. And so when the delegation came back, I had to follow up. I was in the company with the Deputy Director General and other directors of the ministry. We joined the medical superintendent at the Ridge Hospital, and I visited the victims. After going around, we had a closed-door meeting to discuss the issues, not insults. One, how to look at beefing on the internal security, staffing issues. So after the closed-door meeting, I came out to address the press to categorically condemn the physical attack. And that is the most important aspect. And for me, let me at this point reiterate to the whole country that irrespective of the level of provocation at any health facility in this country, nobody, irrespective of your status in society, absolutely nobody has the right to attack any health professional in this country. That is the gravamen of the issue. No diversionary tactics about handshaking. That is what we must concentrate on, to send a clear signal that our health professionals working at the various health facilities are safe. And so after the engagement with the management, when I pulled out of the ward, then in fact, in the engagement with the management, I made it clear to them that I had listened to their side of the story. And therefore, as a minister, I will also listen to the other side of the story. And I then constituted a committee to look into the matter, bring out recommendations for implementation. A lawyer, a nurse, a medical doctor, an auditor, an HR person to go into the matter. Now, when I pulled out, my attention was drawn to a gentleman called Ralph, who was at the center of the controversy. And so he was working towards us as a group. The medical director was with me. The deputy director general was also with me. Then I asked, why did you do this, gentleman? When I asked, most of you were there. I mean, the press, you were there. So you can attest to what I'm saying. You were there with me. When I asked him, the gentleman then stretched his hand, shaking me and trying to whisper something into my ears. Ladies and gentlemen, At this point, should I push the guy that don't whisper anything into my ears? Should I snub him? Should I shout at him? Even if that guy has been prosecuted and sentenced to life imprisonment, and he stretches his hand to shake me, as a minister, as a public officer, I have the duty to stretch and greet him. So let us not reduce the fact that I shook hands with him does not mean that I should stop any measure or any steps that the ministry or government will take to unravel the situation. And so I understand, on a more lighter note, I have been reminded of the fact that I'm a farmer. Yes, nobody needs to remind me. I'm a proud farmer, and everybody knows it. Not until my appointment, I was one of the largest rice farmers in this country, and I'm proud of that. Because I realized that a lot of people didn't understand the issues. In fact, people even thought that I was at the premises when the incident happened, and immediately after the incident, I went and shook hands with the gentleman. Hey, gentlemen, you have done well for beating the nest. Can you imagine? Can you? If I think that way, the president, His Excellency John Dramani Mahama wouldn't have made me the minister for this sector. That would have been insane, right? I mean, with the greatest of respect, I didn't do that, and I will not do that. I have my health workers at heart. But the point must be made. I am a minister for the health workers, and I'm a minister for the good people of this country. Please, we have a lot to deliver, and some of these things will not divert our attention. We will continue to do our best for Mother Ghana. I thank you for the opportunity.
Health Minister Honorable Kwabena Minta Akando, fireman way na Odiama Ghana Registered Nurses and Midwives Association, Omu General Secretary, Maitre Dr. Tankran. Say, ono Akando ankasa de onim so ye farmer. Enu nti no, General Secretary odidi na atemsa na say okasa sa ade a ebuso no de enya no nwa. Na mbom no, osom nurses and afis no osan so som Ghana for. Enu nti no, Ghana Registered Nurses and Midwives Association, Omu General Secretary, on kan hu ne say Ghana na omo chekere. Enu nti nsam kekan bi no ade a ho nte no de emfata. Ebuso chere wa dwema me comment section ho na share video we ma afoforo so nsanke bi me di Kojo Black macro wo pe company ba ko ebusia omusipi esita when it comes to assassin sem any documentation Land King Company Limited and American for omo ama me no ke say omo wo insase bebre no de omo ton ebi ewo oba akrowa Asalaja, Pokwase, Afieman, any other places where the baby bia wope asasi bia no for Land King Company Limited na ebusia omobe soto te saso na eba na cadastral site plan, building plan, any office almost also facilitate a title certificate, any of building permit won SNSM padia or trusted source a Land King Company Limited. No more can say partner S and build confidently.